Hello and welcome to the CPC Certification Review Training with Legacy. This training is designed to assist you in passing the CPC certification exam. This course is not designed for beginners. You should understand the coding process prior to taking this review. There will be 6 questions directed at the 6000 series involving surgical procedures performed on the nervous system and will include codes pertaining to the skull, meninges, brain, spine, spinal cord, extracranial nerves, peripheral nerves, and the autonomic nervous system. The endocrine system is comprised of ductless glands and cells throughout the body secreting hormones and chemical substances regulating body functions such as metabolism, growth, reproduction, and water balance. Glands are organized aggregation of cells functioning as secretory or excretory organs. More simply, a gland produces a chemical affecting distant tissue in the body. Hormones are chemical messengers. They are classified as either proteins or steroids. Hormones stimulate target tissues or organs by binding to the cell receptors located either on the cell membrane or within the cell. Take a moment to review the other anatomy listed on your screen and their location in the body. The pancreas is both an endocrine and exocrine organ as previously reviewed. The carotid body is a chemoreceptor monitoring the oxygen level in the blood. It is not an endocrine structure, but is listed by CPT within the endocrine system code set. The pituitary gland is about the size of a pea located in the base of the brain. It is divided into anterior and posterior lobes. The posterior lobe is attached to the brain by an infundibulum. The anterior lobe has no direct connection to the brain. The pineal gland is small, cone-shaped, and above the cerebellum, and close to the thalamus deep in the brain. It secretes melatonin, thought to play a role in biorhythms and the sleep-wake cycle and may be involved in other functions. The kidneys, testes, and ovaries are glands secreting hormones. They are covered in other sections. The nervous system controls the other systems of the body and is responsible for our being aware of our environment. It is divided into the central nervous system, or CNS, and the peripheral nervous system, or PNS. The CNS includes the brain and the spinal cord. The PNS consists of the nerves connecting to and from the CNS with the rest of the body. There are 12 pairs of cranial nerves emerging from the brainstem and 31 spinal nerves arising from the spinal cord. The nervous system controls and coordinates functions of the organ systems. A nerve plexus is a network of intersecting nerves that combines spinal nerves that serve the same body area. The name of the plexus indicates the portion of the body they serve. For example, the term brachial refers to the arm, while plexus means a network or interweaving of nerves. The brachial plexus is a complex network of nerves that forms in the neck and extends into the armpit region and into the arm. The term plexus is used because the nerves of the brachial plexus interweave and merge with each other to form a complex network that supplies the upper limb. The nerves of the brachial plexus are responsible for controlling the movements and sensations of the arms, shoulder, and hand. The spinal cord is directly continuous with the brainstem. Its 3 major roles are to relay messages from the brain to different parts of the body, to perform an action, to pass along messages from the sensory receptors to the brain, and to coordinate reflexes that are managed by the spinal cord alone. The brain is composed of the cerebrum, cerebellum, and brainstem. The cerebrum comprises the largest part of the brain and is divided into hemispheres. Cerebral hemispheres are made up of elevations and valleys known as gyri and sulci. Hemispheres are divided into lobes. Each cerebral hemisphere has 4 major lobes: frontal, parietal, temporal, and occipital. The frontal lobe is separated from the parietal lobe by the central sulcus. The gyrus just anterior to the central sulcus are called the precentral gyrus and is the primary motor area of the brain. The rest of the frontal lobe is used in modifying motor acts. The posterior end of the brain is the occipital lobe, mainly concerned with vision. The cerebellum protrudes under the occipital lobe at the base of the brain. It is primarily concerned with coordination of voluntary muscles. Disorders of the thyroid glands can be found in E00 through E07. Disorders of the parathyroid gland lists E20 for hypoparathyroid conditions and E21 for hyperparathyroid disorders. Hyperparathyroidism results in increased secretion of parathyroid hormone, resulting in elevated serum calcium, decreased serum phosphorus, and calcium stones. Addison's disease is found under E27.1. Addison's disease can be due to autoimmune diseases. This results in fatigue, muscle weakness, and other symptoms. Addison's disease is a chronic adrenocortical insufficiency. If it is not treated, life-threatening adrenal shock can occur. The lookup for these conditions is critical to establish the correct code to report. The code for diabetes have significant guidelines specific to the diagnosis. Diabetes codes are combination codes that include the type of diabetes, the body system affected, and any complication of that body system. Type 1 diabetes in E10 requires insulin therapy as these patients do not make insulin. Type 2 or adult onset diabetes mellitus patients under code E11 cannot process insulin properly. They are older, obese, and sedentary. Oral hypoglycemic agents often help. Sometimes insulin is also required. Gestational diabetes under O24.4 presents during pregnancy and subsides after pregnancy. Secondary diabetes mellitus is caused by another condition. Category E08 is used when diabetes is caused by a condition or disease such as cystic fibrosis or a malignant neoplasm. An instructional note at the beginning of category E08 states to code first the underlying condition. Exclude 1 notes provide additional codes that are not to be reported with codes from category E08. Category E09 is used for diabetes that is drug or chemical induced. The use of steroids can cause diabetes in some patients. Instructional notes for E09 state to use an additional code to identify any adverse effects or code first a poisoning due to drug or chemical. All categories except type 1 E10 state to report Z79.4 to identify the use of insulin or E79.84 use of oral hypoglycemic drug. It is not required for type 1 diabetes mellitus as insulin is required for these patients. The spinal cord and brain are surrounded by the meninges, serving to protect the brain, enclosing it in a fluid-filled cavity. Inflammation of the meninges is meningitis. Encephalitis, myelitis, and encephalomyelitis are serious inflammations. Encephalitis is inflammation and swelling of the brain. Myelitis is inflammation of the spinal cord. Encephalomyelitis is inflammation of the brain and spinal cord. All are serious, life-threatening conditions. Organic sleep disorder sections list the diagnosis related to sleep. This area of medicine has grown incredibly in recent years with establishment of numerous sleep centers. Apnea refers to absence of breathing. Sleep apnea is a sleep disorder characterized by abnormal pauses in breathing or low breathing during sleep. Pauses can last from a few seconds to minutes, occurring multiple times a night. Sleep apnea is diagnosed with a sleep study. Hypersomnia is a condition in which sleep periods are excessively long. Parasomnia is any dysfunction associated with sleep. Hereditary and degenerative diseases of the central nervous system list serious CNS conditions. Hereditary means transmissible from parent to offspring. Degenerative is a deterioration or worsening of mental or physical qualities. Alzheimer's disease is a progressive mental deterioration with memory loss, ability to calculate, and visual spatial orientation and confusion. Most often it begins late in middle life and often results in death in 5 to 10 years. Parkinson's disease is a neurological syndrome usually resulting from deficiencies of the neurotransmitter dopamine as the consequence of a degenerative vascular or inflammatory changes. It is characterized by tremors, rigidity of movement, and a droopy posture. Pain not elsewhere classified begins with ICD-10-CM official guidelines with many instructions worth reviewing carefully. The codes in category G89 can be used with codes from other categories and chapters to provide more detail. Read these guidelines carefully, finding the appropriate code. The PNS consists of nerve fibers and nerve cell bodies that connect the CNS with peripheral structures. A commonly recognized example of a PNS disorder is carpal tunnel syndrome. Carpal tunnel syndrome is the most common nerve entrapment syndrome. It is characterized by hand paresthesia and pain, sometimes also sensory loss. It is caused by entrapment of the median nerve at the wrist in the carpal tunnel, a bony canal where vessels and the median nerve travel through the wrist to the hand. Neoplasms occur throughout the endocrine and nervous systems. Start with the ICD-10-CM alphabetic index, then to the neoplasm table. Always start in the alphabetic index first. For thyroid gland excision, the key coding concepts are complexity, such as partial or total, approach, and with or without. Excision of the thyroid gland is surgery to remove all or part of the thyroid gland. There are a few other codes in this section that address the parathyroid, thymus, adrenal glands, and pancreas. Parathyroidectomy reports removal or exploration of parathyroids. Wermer syndrome, also called multiple endocrine neoplasia type 1, is an inherited disorder in which one or more of the endocrine glands are overactive or form a tumor. It is most often involving the pancreas, parathyroid, or pituitary glands. Treatment is removal of 3 of the largest and most of the 4th parathyroid glands. An add-on code 60512 reports autotransplantation of a portion of the parathyroid into the sternocleidomastoid muscle after a thyroidectomy in an attempt to preserve parathyroid function. A thymectomy, or removal of the thymus, is performed via several approaches. The medicine chapter of CPT contains 2 codes for endocrinology. These codes are used to report continuous monitoring of glucose during a period greater than 72 hours. There are parenthetical instructions for both these codes. Twist drill hole is done with a handheld drill that creates a smaller hole and is cranked by hand. Burr holes are larger, about the diameter of an index finger. Trephine is a cylindrical or crown saw used for removal of bone or disc, especially from the skull. Craniotomy is an opening in the skull. Craniectomy is excision of a portion of the skull. It is necessary to know the indication and approach for the surgery. Surgery of the skull base procedures often require the skills of surgeons of different specialties working during the same operative session. Procedures listed are classified by approach procedures, definitive procedures, and repair and/or reconstruction of surgical deficits of skull base. There are guidelines listed at the beginning of this section that should be reviewed. When one surgeon performs the approach procedure, another performs the definitive procedure, and another performs the repair reconstruction. Each surgeon reports only the code specific to the procedure they performed and needs to dictate individual operative reports documenting their portion of the procedure. In some instances, one surgeon performs the approach and definitive procedures. In this instance, modifier 51 would be used on the lesser valued procedures. Endovascular therapy contains codes for intracranial balloon angioplasty, intracranial percutaneous, and transcatheter placement of intravascular stents, intracranial, including balloon angioplasty, if performed. Angioplasty is reconstitution of a blood vessel. It can be done with balloon dilation, mechanical stripping, forceful injection, or placement of a stent. The goal of all of these procedures is to restore blood flow to vital structures. Surgery for an aneurysm, arterial venous malformation, or vascular disease is next. The surgical repair of aneurysms and/or arterial venous malformations is reported with these codes. Aneurysm and arterial venous malformations are similar abnormalities in blood vessels. Aneurysm is a dilation of an artery, usually due to an acquired or congenital weakness of the wall of the vessel. Note the definition of complex below code 61698. Arterial venous malformations are vessels through which blood is shunted from arterioles to venules bypassing capillaries. These vascular malformations may be silent for years only to rupture spontaneously or under stress. Codes are divided based on the approach and method used. Stereotaxis, also stereotachy or stereotactic surgery, is medical imaging to precisely locate in 3 dimensions an anatomical site to which a surgical instrument or a beam of radiation is directed to destroy deep-seated brain structures. In this section, stereotaxis refers to lesions of the brain. There are additional codes for stereotaxis further in this section which refer to spinal codes. Neurostimulators. Intracranial describes surgical methods for implanting neurostimulators in the brain. The methods used might be by twist drill, burr hole, craniectomy, or craniotomy. Read the instructions and the codes carefully when coding from this category. Neurostimulators spinal subsection lists devices implanted in the body and designed to treat neurological disorders. Simple and complex neurostimulators placed percutaneously or with open placement are used to report these procedures. Neurostimulators have pulse generators and electrodes, much like pacemakers and implantable defibrillators. Key coding concepts are the procedure, such as implantation, revision or removal, and number. An intracranial neurostimulator is an implantable device that sends electrical impulses through implanted electrodes to the brain to treat a variety of conditions, such as Parkinson's or epilepsy. Repair of the skull codes report fracture repairs, CSF leak repairs, craniotomy, and cranioplasty codes. There is a small section of codes for neuroendoscopy. Neuroendoscopy allows a neurosurgeon to make very small holes in the skull of a patient or to go through the nose or mouth to pass a scope into the skull cavity or brain to access parts of the brain unable to be reached via normal surgery. CSF shunt codes are used for placement of shunts or drains to remove cerebral spinal fluid. If this vital fluid that bathes the brain and spinal cord doesn't drain properly due to a tumor or other blockage, increased pressure can cause brain damage. These codes report the creation, replacement, revision, and/or removal of CSF shunts. The section for the spine and spinal cord includes several codes, listings, and categories. This section begins with instructions regarding imaging and catheter-based treatments of targeted areas. Included in this section are injection, drainage or aspiration, catheter implantation, reservoir pump implantation, and laminectomy and laminotomy. The main distinction is the condition being treated. Coding spinal procedures requires considering the condition, the approach, unilateral or bilateral, and if multiple procedures were performed. Spinal tap or lumbar puncture is listed in injection, drainage, or aspiration section. CSF is obtained by inserting a needle into the subacondal space in the lumbar region. Various conditions such as infection or hemorrhage can be diagnosed. Lumbar puncture can also be done for therapeutic purposes. Catheter implantation codes are reported for the implantation, revision repositioning, or removal of an intrathecal or epidural catheter for long-term medication administration. The implantation of reservoirs or pumps for intrathecal or epidural drug infusion have their own category. Laminotomy, laminectomy, exploration, and decompression procedures have their own categories. The approach of the surgery is a primary consideration for these procedures. Another key element in coding from these categories is the add-on codes from the number of interspaces. The instructional guidelines and parenthetical instructions help with code selections and appropriate modifiers. When selecting codes for laminotomy, laminectomy, exploration, and decompression, pay attention to the number of the interspaces. Interspaces are the space between the vertebrae. For example, a procedure performed on L1, L2 would be reported as one interspace or the space between those two vertebrae. If a procedure is performed on L2 through L4, two interspaces, L2 through L3 and L3 through L4, are involved. For laminotomy, the key coding concepts are anatomical site and number. A laminotomy is an orthopedic neurosurgical procedure that removes part of the lamina of the vertebral arch in order to decompress the corresponding spinal cord and/or spinal nerve root. Laminectomy is a surgical procedure that involves removing a portion of the vertebral bone called the lamina, which covers the spinal cord and nerves. The lamina is a thin, flat plate of bone that forms the back of the spinal canal and helps protect the spinal cord and nerves from injury. A laminectomy is typically performed to relieve pressure on the spinal cord or nerve root caused by spinal stenosis, which is a narrowing of the spinal canal. This narrowing can be caused by a variety of factors, such as degenerative changes in the spine, herniated discs, tumors, or trauma. During a laminectomy, the patient is placed under general anesthesia and an incision is made in the back over the affected area of the spine. The muscles and tissues are moved aside and the lamina is removed using surgical instruments such as a drill or a bone-biting tool. Once the lamina is removed, the spinal cord or nerve roots are visible, and any tissue causing pressure on them can be identified and removed. Spinal decompression surgery is a general term that refers to various procedures intended to relieve symptoms caused by pressure or compression on the spinal cord and/or nerve roots. Discectomy is one procedure that involves removing a disc between spinal vertebrae. An osteophyte is a bony outgrowth from the vertebra. Osteophytectomy is removal of this bony piece. These bony protuberances can be a problem by putting pressure on the spinal cord. A corpectomy is a procedure to decrease pressure on the spinal cord by removing one or more vertebral bodies. Coding concepts include anatomical site, cervical, thoracic, and lumbar, segments versus interspaces, the number, and approach, which could be percutaneous, endoscopic, or open. Stereotaxis is a precise method of destroying deep-seated spinal structures located by use of three-dimensional coordinates. Neurostimulators spinal are devices implanted in the body and designed to treat neurological disorders. They are placed percutaneously or with an open approach, inserting electrodes and pulse generators. Extracranial nerves, peripheral nerves, and autonomic nervous systems include categories for injection, destruction decompression, and repair procedures. PNS is the peripheral nervous system. It consists of the nerve fibers and nerve cell bodies that connect the CNS with peripheral structures. Peripheral nerves are either cranial or spinal nerves. Of the 12 pairs of cranial nerves, 11 pairs arise from the brain. One pair, cranial nerve 11, arises mostly from the superior part of the spinal cord. Somatic nerves can be sensory, pain, temperature, etc., or motor, skeletal muscle movement. Facet joint injection may describe either a nerve block or more extensive nerve destruction. An injection focuses on the joint area between adjacent nerves. One nerve block level will include two nerves. Nerve blocks produce interruption of conduction of impulses in peripheral nerves or nerve trunks by injection of anesthetic. When a nerve block is performed, anesthetic or steroid agents are not injected directly into the nerve. The medication is injected around the nerve or into the area of the nerve. These blocks are reported according to the nerve or plexus targeted. Choosing the correct nerve block code requires you to know the location, whether cervical thoracic or lumbar sacral, and they are broken down by the number of levels that are documented. If there is an infusion, note that duration is required to document the time. If the exact time is not coded for the continuous or single-use infusion, only a push can be coded. Neurostimulators, peripheral nerve, report both simple and complex devices. There is a note at the beginning of this section reminding that initial or subsequent electronic analysis and programming of neurostimulator pulse generators are reported from codes in the medicine section. Destruction by neurolytic agent is divided by somatic and sympathetic nerves. Neuroplasty is the surgical decompression or freeing of intact nerve from scar tissue. A familiar procedure in this section is carpal tunnel for patients suffering from carpal tunnel syndrome. For neuroplasty, the key coding concept is anatomical site. Neuroplasty is the surgical decompression or freeing of intact nerve from scar tissue. Excision by nerve removes a tumor or mass growing on one of the 7 major peripheral nerves of the body. Neurography or neurography with nerve graft categories list nerve repair based on nerve repair. Grafting codes are included. Many of these procedures are intricate and require the use of an operating microscope. Read the guidelines and parenthetical instructions carefully to avoid bundling issues. Sleep studies or sleep testing is found in the medicine section. Many parameters of sleep are recorded, including EKG, airflow, respiration, and many others. Recordings require continuous monitoring for at least 6 hours. Append modifier 52 when time stated in the coding guidelines is not met. Muscle and range of motion testing are specific manual muscle testing of extremities, trunk, hand, and/or total body. EMG evaluates causes of weakness, paralysis, muscle twitching, or other problems. Evoked potentials or reflex testing measures the brain's electrical activity in response to stimulation of specific nerve pathways. Neurostimulator analysis and programming is coded by type and location and by simple versus complex. Parts of the eyeball. The eyeball consists of an anterior and posterior portion. It is suspended by 6 eccentric muscles that control its movement. The outer layer of the posterior portion is called the sclera, which is a tough connective tissue. It is the white part of the eye. The cornea is transparent and highly sensitive to touch, covering the portion of the eye seen from the anterior side as the pupil and iris. The middle or vascular layer is a very thin layer between the sclera and retina. The internal layer is the retina. This pigmented nerve layer lines the back of the eye, sensing light and color directly in contact with and sending messages along the optic nerve to the brain. The optic disc is an elevated visible portion of the optic nerve inside the eye. The middle ear begins at the tympanic membrane. The middle ear is an air-filled chamber in the temporal bone. Besides the tympanic membrane, the middle ear contains tiny bones, 3 of them known as ossicles, and the tube. The tympanic membrane vibrates in response to sound waves converted into mechanical vibrations. Vibrations are passed through the middle ear to the inner ear by the 3 tiny middle ear bones, which are the smallest bones in the body. Vibrations from the tympanic membrane is transferred to the ossicles and then to the oval window, a membrane separating the middle ear from the inner ear. The inner ear is an intrinsic maze of fluid-filled tubes running through the temporal bone of the skull. Inside the bony labyrinth is a second set of tubes, also filled with fluid. These membranous labyrinths contain the actual hearing cells or hair cells. Movement of these hair cells converts the vibration into a nerve impulse. The bony labyrinth has 3 parts. The inner ear has 2 membrane-covered outlets into the air-filled middle ear, the oval window, and the round window. Nerve impulses from the inner ear travel along the cochlear nerve for hearing and to the vestibular nerve for equilibrium. The most common diagnoses of these sense organs are located in the chapters listed. Most of the diseases listed that impact the eye are listed here. Glaucoma happens when the flow of aqueous humor in the anterior chamber of the eye is not in balance. When this flow slows, the pressure builds up in the anterior and posterior chambers of the eye. This condition is called glaucoma, which can result in blindness if left untreated. Cataracts are complete or partial cloudiness of the lens of the eye. This typically happens to adults as they age. Retinopathy is a non-inflammatory degenerative disease of the retina, many times occurring in diabetics due to circulatory problems experienced by diabetic patients. It is a progressive illness beginning with hemorrhages or aneurysms in the retinal vessels causing damage to the retina. With disease progression, scar tissue forms resulting in serious vision problems. Most of the diseases listed that impact the ear and mastoid process are listed here. Vertigo is a type of dizziness that is characterized by a sensation of spinning or movement even when a person is stationary. It is often described as feeling like the room is spinning around you or feeling like you are spinning or moving when you are actually still. Vertigo is usually caused by a problem in the inner ear or the part of the brain that controls balance and spatial orientation. The inner ear contains fluid-filled canals that are responsible for detecting movement and changes in position, and when these canals are disrupted or damaged, they can send confusing signals to the brain that cause a sense of motion. Other common causes of vertigo include viral infections of the inner ear, Meniere's disease, which is a disorder of the inner ear that causes episodes of vertigo, hearing loss, and ringing in the ears, head injuries, certain medications, and neurologic disorders. Symptoms of vertigo can include a feeling of spinning or movement, nausea or vomiting, sweating, headache, abnormal eye movements, difficulty standing or walking. Treatment for vertigo depends on the underlying cause, but may include medications to relieve symptoms, physical therapy to help with balance and coordination, or surgery in severe cases. Eyeball codes listed first include 3 ways to remove the eye. Malignancy is most often the reason for this dramatic surgery. Evisceration of ocular contents is removal of the contents of the eyeball, leaving the sclera, muscles, and sometimes the cornea. Enucleation is removal of the entire eyeball without rupture. The conjunctiva may remain. Codes specify if an implant is placed and if muscles are attached. Implant codes are for permanent implant placement, not for a temporary placement. Extenuation of orbit is invasive surgery. It describes removal of contents of a cavity. The underlying condition is more serious and invasive. In this case, muscle, fat, and even bone are removed. Secondary implant procedures are listed as secondary procedures. In these situations, modification of an implant, secondary implant placement, reinsertion, or removal of an implant may be required. In the case of excision for a more serious cancer, it may be best to allow healing of the area before placing an implant.
Lens codes are booked by incision and removal. Cataract removal is the primary procedure in this category. There are instructions for review explaining components of these procedures reported with the codes. Pass planar approach is an open procedure to get to the back of the retina or vitreous. Intraocular lens procedures have 5 codes. These codes report procedures on the lens and its capsule.
Ocular Adnexa deals mainly with extraocular muscles. A coordinated effort of all muscles is required for intrinsic eye movement. Think of a batter attempting to hit a 98-mile-per-hour fastball. Strabismus is a disorder in which both eyes do not line up in the same direction, so they do not look at the same object at the same time. This condition is more commonly known as cross-eyed. Strabismus surgery in this section is grouped into that performed for horizontal and vertical muscles. With the transposition procedure, the superior rectus muscle is transposed or moved. Adjustable sutures can be placed in strabismus surgery. This section of CPT contains valuable pictures worth reviewing to make sense of these procedures. Most procedures on the eye are performed with a microscope and are included in the procedure code. Pay close attention to the guidelines indicating when not to use the microscope. Listed in the medicine section of CPT under ophthalmology are codes reporting services for general ophthalmology services, special ophthalmological services, contact lens services, and spectacle services. There are instructions at the beginning of this section defining the differences between intermediate and comprehensive ophthalmological services. There are also instructions regarding special ophthalmological services. The first codes listed here are based on new and established patient criteria and level of service provided. They are evaluation and management codes, also known as E&M codes. This can be confusing. General ophthalmological services list 4 codes for new patients and established patients. Definitions for new and established patients are important. A new patient has not received professional services by the provider or one in the same group within the past 3 years. An established patient has. Under the removal listings, removal foreign body from external auditory canal, codes are chosen based on use of anesthesia. 2 codes exist for removal of earwax. 69209 when the wax is removed by lavage or irrigation. This is accomplished with a large syringe squirting water into the ear canal to dislodge the plug of wax. This is a unilateral procedure, and if performed bilaterally would be reported with modifier 50. 69210 is reported for removal of earwax using instrumentation, such as ear spoons or microscope. This code is also for one ear. Modifier 50 is reported if both ears are cleaned. Guidance is provided instructing the user that if the earwax is not documented as impacted, the service is reported with the appropriate level of E&M code. Middle ear is a larger section of codes. It is grouped by introduction, incision, excision, repair, and other procedures. Tympanostomy is synonymous with myringotomy, which is creating a passageway through the tympanic membrane. Mastoidectomy complete is removal of the mastoid bone. Malignancy or extremely serious infection necessitates this procedures. Listed next are more extreme procedures, modified radical and radical. For tympanoplasty, the key coding concepts are type of procedure and with or without. Tympanoplasty is a surgery to reconstruct the tympanic membrane and can be performed either under local or general anesthesia. An incision is made into the ear canal and the remaining eardrum is elevated away from the bony ear canal and lifted forward. Inner ear is grouped by incision and/or destruction, excision, introduction, and other procedures. The structures of the inner ear are extremely small. Labyrinthectomy reports removal of the labyrinth in the middle ear. This is a very small, well-protected structure, very difficult to get to. Temporal bone middle fossa approach contains 5 codes. Decompression usually refers to a nerve that is under pressure. Decompression procedures are performed to relieve pressure. At the end of this section is a long discussion regarding the operating microscope. Microscopic surgery is of critical importance regarding the procedures performed in the ear and on the eyes. These instructions are worth reviewing. Listed in the medicine section of CPT under Special Otorhinolaryngology Services, vestibular function tests without electrical recording, vestibular function test with recording, audiological function tests, and evaluation and therapeutic services. At the beginning of the section are brief instructions as in the eye section. Special otorhinolaryngology services are those diagnostic and treatment services that are not included in the E&M services and are reported separately using these codes. There are services such as otoscope and removal of non-impacted earwax that are reported as E&M codes and not separately reported. Otolaryngology examinations under general anesthesia is obviously not a routine exam due to the use of general anesthesia and is special. Vestibular function tests list codes used to report testing of the vestibular function, listing 4 codes. Be sure to read and note to ensure correct selection of codes. Also, be sure to read all instructional notes regarding modifiers and codes that may not be built together. Thank you for joining us for this review. If you would like more details about our intensive CPC training or any of our other training programs, please visit our website at medicalbilco.com.